I appreciate the President's willingness to listen, to engage governors of different parties, to talk with those with different perspectives, governors who come from different parts of the country, because as Washington crafts federal energy policy, it's important that the voices of the states be heard. I was happy to share with the President and his administration some of the great things that we're doing in Vermont. Our investments in energy efficiency lead the nation, and the statewide smart grid that we're working on is an exciting opportunity that can be a model for other states and indeed for the entire country. There's also innovative progress being made by small-scale renewable energy producers in Vermont. I took the opportunity to remind the President and my colleagues, for example, that we lead the nation in methane digesters per capita. Vermont has the greenest energy portfolio in the nation. We're partnering with states in our region in efforts such as Entergy, the Regional Greenhouse Gas Initiative, to tackle the challenge of climate change. So I really think that, as in healthcare, Washington can learn from what we're doing here in Vermont. But I recognize that the rest of the nation isn't Vermont. There are other states that still rely heavily on coal and other carbon-intensive sources of power. So rather than focusing on a policy that mandates a certain percentage of energy to come from renewable sources, I think a better approach to achieving energy independence and a cleaner environment would be to set goals to achieve low or reduced carbon emissions, while giving states flexibility to meet those goals. For some states that may mean a greater reliance on wind or solar. Others will find biomass, nuclear, geothermal, or hydro more effective. But based on our experience here in Vermont and the experience of other states that have made substantial strides in ensuring greener energy supplies, I think it will ultimately be up to states to figure out what works best. So I think it's essential that Congress and the administration work together on a bipartisan basis to chart our nation's energy future. The meeting we had yesterday will contribute to that process in an important way. I hope to continue working with the President and his team, as well as our own congressional delegation and others, to help achieve the goal of a cleaner environment and more secure energy future. I wasn't in Washington yesterday just to talk about energy policy. I also had the opportunity to meet with the Secretary of Health and Human Services, Kathleen Sebelius, a former gubernatorial colleague, along with other administration officials in the health policy area, and some of my gubernatorial colleagues to talk about issues related to healthcare reform. As everybody knows, there's a political stalemate in Washington. The fate of federal legislation is uncertain at this point. But as we've shown in Vermont, healthcare reform is already happening. It's happening in states across America. As part of my initiative as chairman of the National Governors Association, reform of our healthcare delivery system and slowing the growth of healthcare costs will be the focus of our NGA winter meeting in just a couple of weeks in Washington. I anticipate some robust discussion among the governors at that point surrounding both state and federal-based reforms. I'm looking forward to having those discussions and continuing to work with policymakers in Washington to see if we can't find some common ground and move some healthcare reform legislation through the Congress this year.
What do you think that would take? What form would that take? Do you have some suggestions? I mean, in terms of what you would like them to see that's already been passed, perhaps?
Well, the devil's in the details. I think the most important point at this stage is that we need to come together on a bipartisan basis, which was not achieved during the earlier steps in the congressional process in Washington. I think many Americans were disappointed that everybody on one side of the aisle voted one way and everybody on the other side of the aisle voted the other way. And healthcare costs and quality and coverage are not partisan issues. Many of the Democrats in the National Governors Association were strong supporters of the administration's initiatives. Many Republicans were strongly opposed. Now that the political dynamic has shifted, one might expect the Republican governors to try to resist any meaningful change, but I'm pleased to tell you that most of my colleagues don't want to take that posture. They want to work together to find some ideas that make sense. But determining what those are is the tricky part, and yesterday was the first of what I'm sure will be many meetings to talk about those possibilities. They'll continue at some length during the NGA meeting later this month, and at some point we can find some common ground.
How successful has healthcare reform been in Vermont? The catamount health goals are unlikely to be met. Your administration considered whether it was time to get rid of the program altogether, and payments by those covered are going to increase on it, and healthcare costs in the state are still going up faster than inflation. So how successful has it been in Vermont?
It's been very successful in several different ways. We have, I think, the second lowest percentage of uninsured population in the nation in Massachusetts. It reduced over the last few years from about 10 to about 7.5%. Secondly, we have saved considerable dollars in our Medicaid program through the Global Commitment Waiver, the Choices for Care program, medical home initiatives, the Blueprint for Health, the strategies we put in place that are really making a difference. I mentioned, as you know, during my speech earlier this year, that there was a young lady in the balcony who was a face on the kind of healthcare reform that I think the entire nation can pursue. That the medical home model, the community health team, the idea that we want to take care of people, keep them well, keep them out of the emergency room and the hospital, and in the long run that will save money. Our projection is that during the 5-year Medicaid Global Commitment Waiver period, we will save nearly $250 million from what we would otherwise have expended in our Medicaid payments. We've downsized our nursing home bed capacity in Vermont by a couple of hundred because we're keeping more people at home, even as we have an aging population. I think there are great examples of tremendous success in our state. Not that we have all the answers, but we have some answers. And I think if we look at the models that work all across the country, we can find the basis for reform. You may recall on a specific point that last September, Secretary Sebelius announced that Medicare would join other payers in the medical home pilot program model that we have in place here. I particularly appreciated the Secretary's comment that, quote, Governor Douglas had a good idea, unquote, because I explained to her that all the payers, including Medicaid, have been participating in this model, but Medicare has not been, and we need to have everybody at the table. So she indicated at that point that the department, through the rulemaking process, would begin to include Medicare. She noted, before I had a chance to bring it up, that the rules hadn't been completed yet, and assured me that she would make that happen